Well, I've been talking about cancer risk factors for more than 30 years, and one of the things that I've observed over that period of time specifically is the extent to which we, primarily in the Western rich countries of the world, are very reluctant to talk about alcohol and cancer in the way we do with a number of other risk factors. For the most part, we well-off, middle-class Western people don't smoke. So it's easiest for us to talk about smoking as a risk factor and discourage other people from smoking because we don't do it. When it comes to alcohol, where the International Agency for Research on Cancer has reported since 1988 that alcohol consumption contributes to cancer risk, we've been far more reluctant to talk about alcohol as a risk factor. I've been talking about that at these meetings for more than 15 years. And still, last night, someone said to me, do you drink wine? And I said, yes, I do. And I have one glass of wine with my dinner. Not every night. I try and make sure I have 3 or 4 days when I don't have alcohol. But ultimately, what I choose to do or don't do with the evidence that I am very familiar with is far less relevant than what I do in my paid job. My paid job is to tell people what the evidence says and to advocate for policies consistent with that evidence. So the first thing is, the evidence is pretty clear. There's some debate around the edges, and there always is in epidemiology, but it's pretty clear. The more we consume in terms of alcohol, the greater the increase in risk of cancers that are linked to alcohol. Colorectal cancer, breast cancer in women, a range of esophageal and various other gastrointestinal cancers, liver cancer and others. So if that's the case, surely it's our fundamental responsibility to ensure the people we serve know that fact, know that scientific evidence. So therefore, what we consumed last night shouldn't play a role in that. We should not be providing health information through the prism of the glass of wine that we consumed last night. We have to tell people what the science says. And if we fail to do that, we fundamentally fail our responsibilities to the communities we serve. Well, this is where we learn from our lessons of other parts of cancer control. An example that everybody's familiar with is tobacco. So when we talk about the connection between consumption of tobacco and cancer outcomes, we talk about a whole range of strategies which we now have seen and proven to be effective. Price controls. Tax on tobacco results in reduction of consumption of tobacco products. We also know, and there's evidence that that's the case with alcohol as well. And yet, do we hear cancer societies thundering into finance ministers and health ministers' offices and demand an increase in alcohol tax? Sadly, the answer is not much. No, we don't see much of that. Similarly, in terms of simple warning labels, only this week the Irish Parliament has passed a bill to require alcohol warning labels, specifically making reference to the cancer link. That's a very important step forward, and as the Irish Cancer Society CEO Averill said, if Ireland can do it, anybody can do it. So the suite of things that we've tried, looking at restrictions on marketing of alcohol, for example, there's an extraordinarily powerful and ruthless and relentless campaign by the alcohol industry to recruit our kids. They make products that are sweet and are palatable to children. They promote them so that kids as young as 14, 15, 16 are drinking alcohol in excess at a time when they're in a stage of important development physiologically. And then, of course, ensuring that the rite of passage for those kids to become adults somehow involves alcohol. So we need to challenge some of those cultural norms. And there's many organisations that have been working in the alcohol control space for a long time, but mostly from the point of view of short-term harm, motor vehicle accidents, accidents at work, those kind of immediate effects. There's not nearly sufficient focus on the chronic adverse effects of alcohol. And the other reality the alcohol industry has managed to create in people's mind, which is in fact a myth, is that red wine is the elixir of life and that it's healthy for all of us and will save all of us from cardiovascular disease. Point blank, it's bollocks. Most people have no notion that alcohol increases cardiovascular disease. And again, at high levels, very high levels of increase in risk of cardiovascular disease. But this is a cancer conference, and so we're not here to talk about cardiovascular disease, but it's an illustration of the chronic diseases to which alcohol contributes, which are largely ignored. So we talk about drink driving, we talk about violence, we talk about social disruption and family problems, and those are important adverse immediate effects of alcohol. But what we have failed, in my view, to do is adequately communicate the long-term harm of alcohol consumption. And I think it's largely because there's this notion of cognitive dissonance. That is, if it doesn't align with our own behaviour, we're uncomfortable to say it. We feel as though we should live up to the same standards that we're recommending to other people, and if we don't, we're somewhat muted in our advice and in our advocacy. And I think it's wrong. And I think it's time we looked into our own souls and asked the question, are we being fair and communicating the evidence clearly, bravely, truthfully, in the way we seek to do in all other spheres of cancer control? We've got to challenge ourselves first. Well, it's interesting. I mean, only last week, the high-level meeting in New York, the presentation on that only yesterday talked about the fact that alcohol has been now recognised as being one of the contributing factors to NCDs. So it was even depicted as being the Cinderella issue. So Cinderella's come out of the closet and now she's a part of the gang. She's a part of the gang of obesity and tobacco and the like. And that's a very important step forward. And hopefully out of that there will be a greater degree of consistency. And one of the parts of my presentation, I was invited to look across the international community about the kind of advice that governments provide to their citizens about alcohol consumption and healthy drinking guidelines. And I was absolutely shocked at the extent to which they are extraordinarily divergent. Even the simple thing of defining what is a standard drink. How many grams of alcohol is in a standard drink? In some countries it's 8, in some countries it's 14. Extraordinary divergence. Some countries make recommendations about how many grams of alcohol you should drink as a maximum per day. Some tell you how many grams you should drink as a maximum per week. Some tell you how many drinks you should have in a day. Some provide you with advice that's different if you're between 18 and 25 or maybe over 65. There's variance as to whether you get different advice as to whether you're a man or a woman. It's a dog's breakfast. It's almost unfollowable. And then some provide so many caveats and more details in their recommendations, how many alcohol-free days a week you should have, that with the same fundamental set of underpinning evidence, we're providing people with extraordinarily diverse advice. And yes, it may be fair to have some level of cultural recognition of local behaviours and patterns and habits, but at that level of diversity, it's very clear. We've failed even to get to first base when it comes to responsibly reporting to the people that we serve simple health information when it comes to alcohol, such an extraordinarily widespread, ruthlessly and heavily promoted commodity within our communities. Alcohol contributes to cancer risk. The more you drink, the greater you increase your cancer risk. Limit your alcohol consumption, certainly no more than 2 drinks a day, and make sure that the policies in your country reinforce low levels of consumption.